patient has their own journey. As the treatment for breast cancer is continuously evolving, patients have more options when it comes to their path of care. Joining us today is Dr. Pat DeFusco, the director of the breast program at Hartford Healthcare, to discuss treatment options for breast cancer. Doctor, so great to have you with us today.
Thank you for having me, Catherine.
What is meant by early stage versus metastatic breast cancer?
So most women will present with early stage disease. So when they're diagnosed, they may have a lump, which may or may not involve the lymph nodes, and they tend to get treated with a combination of surgery or radiation and/or drug therapy, which could either be hormonal therapy or pills or chemotherapy. And then they are put into the surveillance phase.
So what is appropriate surveillance for early stage breast cancer?
At this point, we tend to still follow patients clinically. So we base that surveillance on the history and the physical exam. And we ask patients to come in about every 6 months for these exams. It's not perfect, but we don't yet have evidence that routine imaging like CAT scans and bone scans and PET scans helps us to find things earlier. What is on the horizon are blood tests looking for predominantly tumor DNA that might help us to detect minimal residual disease, and that is on the horizon.
What are the goals of care for metastatic breast cancer?
So about 20% of women who have node-positive breast cancer diagnosis may go on to develop metastatic disease. And at that point, our goals are trying more to control it. With early stage disease, our hope is that we can go for cure and prevent any recurrence. But if the cancer does recur, there is still plenty of hope, and we have great modalities to try to control that disease.
I think a lot of people want to know, what are some of the treatment options for metastatic breast cancer?
So again, it depends upon the type of breast cancer. If breast cancer recurs, we try to get a biopsy to confirm the recurrence and to look at the characteristics of the cancer so that we can appropriately base therapy. If the cancer is still sensitive to hormonal treatments, there are many hormonal treatments that we can use and combine them with drugs that have really improved our ability to prolong the time to progression. If the cancer has the HER2 protein as a target, we can use specific proteins, and there's been just a number of new drugs over the past few years that have allowed us to do that. And even for women whose breast cancer may not be sensitive to any hormones or HER2, there's the possibility of using immunotherapy, and a drug that's come out a few years ago called sacituzumab has been very helpful. So our goal is to prolong, survival as long as we can with as good a quality of life as is feasible.
As you know, October is Breast Cancer Awareness Month, but how important is it that awareness continues beyond just the month of October, Doctor?
It is very important, and I think through COVID we found that women who've delayed their mammograms may have put off some important screening. So it is critical that women attend to their mammograms, that keep vigilant for any new signs or symptoms as we go forward. We still want to find more breast cancers in that early stage where our goal is cure.
All right, great advice. Dr. Patricia DeFusco, the director of the breast program at Hartford Healthcare, thank you for joining us today.
Thank you so much for having me. I appreciate it.